Unfortunately, Canada has now reached another grim milestone, over 400,000 cases now overall of COVID-19 since the first cases began back in late February, early March. What do you think of where we're at now? It's December the 4th, and these vaccines are coming. Of course, not soon enough, obviously, and sort of, getting from the here and now with that 400,000 number to where we need to be.
Yeah, I think if we look at this pandemic as if it's a story with a beginning, middle, and an end, we're certainly in solidly in the middle at this point, but that end is in sight. But in many ways, this winter is going to be the toughest challenge we've faced yet. I think our number one priority right now has to be getting cases as low as possible going into the Christmas season, because we know that there are going to be gatherings, that we know that there's going to be travel, and that could have a very serious ripple effect going into the new year. And as much as we can get cases down as possible before then, I think will pay great dividends going into the new year.
And we're hearing from the top doctor, Theresa Tam in Ottawa, about sort of exponential growth if the trajectory continues. So here we are surpassing 400,000 cases as of today, as of just a few minutes ago. But we could see 10,000 cases potentially a day come January.
Yeah, I think we're going to start seeing the effects of some of the more severe restrictions in those existing hotspots. Certainly, we've seen growth slow down in places like Peel and Toronto. Hopefully, we'll see growth slow down in Alberta, which has just been increasing at a very alarming rate. But we also have to keep an eye on areas outside of Toronto and the GTA. As much as we are the center of the universe, there's a lot of concerning trends going on in places like Waterloo, for example, or a number of other districts which you mentioned earlier. And so I think, the sooner we can act on those and clamp down on those trends outside of the GTA, then we have a much greater chance of averting numbers like in those worst case scenarios that Dr. Tam was quoting.
Jean-Paul Soucy with his read today. Hey, thank you for taking some time.